Hi, my name is Dr. Jimmy Woodson. I'm a general dentist in Nags Head. This is an educational video to help you care for your child's teeth. So there's more information on our Facebook page. Just search for Woodson Dentistry and you'll find lots of good links there. Thanks. Have a good day. Brush. Okay, what we're going to do today is show a way to position a little patient like this at home so that it's really easy on your neck and so that you can see and so that you can do a good job. We're going to brush and then we're going to talk about some flossing. So this is Marla. She's my littlest one. She's 5. And this works really on any child that's too big where they're falling off of your lap. You can just stand them. If they're really little, you may have to crouch down because they're so short. But what you want your child to do is tip your head way back, Mama. Look way back behind you. Okay? So when their chin is way up and they lean back and they're right here on your hip. Open big and wide. So she opens them big and wide and this finger goes in here. Come in tight. Let's get a closer look on what it looks like in the mouth. Tip way back more. So I can visualize her teeth and I can get the brownie out of the mouth, whatever might be there.
I got cookie.
You got cookie? Okay. So, and then notice my finger comes about to the midline and that's it. Notice how well the brush retracts the cheek. And I can see what I'm doing. So I do the biting surface, I do the inner surface. Notice how the angle the brush goes in. Pretty much the same all the way around. Then I do the outer. Okay, or the lip side. Little circles, little circles. Go to the bottom, my finger comes in again. Marla, try to turn your head side to side. She can't get away. So if you have an unruly child at 8 o'clock at night, they're really not going to go anywhere as long as you've got that hook. Now open a little bit, Marla. So I do the tongue side. Marla's got some, I think some wrap from Smoothie Place still in here. And now notice how my finger gets the lip away. Marla has got a tight... Yeah, a little ulcer. Well, stay right there. Don't open so far. Now it's much easier for me to get the lip retracted. And she has a very strong lip. So this finger has to be here for me to clean these teeth. Okay, and stick out your tongue. And then we'll finish with the tongue. Now. It's tough. Now, this is the floss.
Floss right here.
Still got me here? Feel like this is a ShamWow commercial. You with me here? Okay, so. Here's my floss. Now, I wrap the floss around my middle fingers. Wrap, middle fingers, because I want these fingers to be free. Okay? So, come in tight. So, we start on the bottom. I got my head against the hip, because if I don't have my head, her head against the hip, look, they just go everywhere. And then you have to push the floss hard, and then it hurts their gums. So, we'll floss between any two teeth where you don't see a lot of daylight. If you see a lot of daylight, don't floss it. It's okay. You can do it with the brush. So we pop it in between the teeth. We clean the tooth forward of the space and the tooth behind the space. Floss, clean the forward, clean the back. Notice I'm pushing the floss toward the tooth that I'm cleaning with the floss. And floss, 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 floss. Pop, pull forward, clean one tooth, push back, clean the other. Bada bing, all done. So that's the deal. I would recommend that for a child this age that you brush them in the morning before school and before they go to bed and floss them right before they go to bed too. You get a school-age child that's 7, 8, if you want to let them do it in the morning and you do the floss, then the brush at night, that's probably okay if they're conscientious. But you have to remember, once they get to 6 years old, they have adult teeth they're going to have forever. So they're not really old enough to take care of something adult, but yet they have it in their mouth. So that's how I do it at home at 8 o'clock with a sore neck and a sore back. So it helps me. I hope it helps you. Thanks.
Bye.